morning, ladies and gentlemen. First, I would like to thank the organizers of this meeting, that is the College of Medicine Educational Unit, headed by Professor Augustine Adeolu, for inviting me to give this lecture. Last year, Dr. Timilola Akonde and myself gave this lecture, as was the case, I think, for the 2 years before. And it's a privilege to come once again, to come to this beautiful place to give this lecture again. The topic of the lecture is evaluation of teaching. And we all are teachers, or should be teachers. It's often said that being a lecturer does not make you to be able to teach. For you to be able to teach, you must learn what it takes to do this. And this is a beautiful venture by the College of Medicine Educational Unit. In 2009, that was just before the commencement of the first online master's program in West Africa. There was a preceding assessment, needs assessment through a survey. And during that time, almost everyone agreed that lecturers should be taught how to teach. And so the program started with the aim of making lecturers to acquire teaching knowledge and skills. And it ran till about 2011, when it ran into some problems. And there are still indications that the program will be re-established, because the very important one, lectures on the program were given by lecturers from the College of Medicine and also from the Faculty of Education and also sociology departments and psychology departments. The aim was to impact on lecturers the ability to be able to teach. And one of the modules was how to even evaluate programs, as well the curriculum that is drawn up, that how to evaluate them to make sure that they are serving the purpose for which they were intended. So today we're going to talk about evaluation, like I said. So I want you to take out your phones and go to the Pedagogy WhatsApp platform, which you are in, and answer true or false to this question. Evaluation is an affront to my academic autonomy. And in a moment, we'll be able to see why the question. We'll also be able to understand this, because I'm sure a lot of us would have heard about evaluation and a lot of things said about it. To start with straight away is to say that yes, the College of Medicine had actually tried to evaluate teaching, but the way and manner in which this was done was suboptimal. The students were not clear about what to evaluate, and the lecturers of the teachers were more scared about the exercise. And so it is not yet perfect, as we can see as we go along the lecture. So evaluation is necessary in order to assess the quality of education, and there are instruments that are used which must be fair. That is to consider not just the person teaching, but the environment in which the person is teaching must be accurate. You must not be just about any question. It must be questions that will impact the program, and it must use instruments that are reliable of the teaching quality, because it is so often easy to go astray in evaluating teaching and missing an important part of the exercise, but more importantly, also alienating students and lecturers, taking them away from what should be really something very beneficial to both. Evaluation seeks to describe and explain experiences of students and teachers, and to make judgments and interpret their effectiveness. It must be an essential part of the educational process for quality improvement, and it is analogous to a clinical audit that is very well conducted. A health professional curriculum must evolve in response to the needs of students, institutions, and society, because we must not forget that these are the essential beneficiaries of the exercise. So when a teacher stands in front of students, the implications of what that person is doing reach far and wide, and will benefit the students to make them better health professionals, the institution which continues to produce them, and society. We often talk about taking gown to town. This is part of it. What is taken from the gown to the town must be of quality. It's often confused with assessment and appraisal. There are subtle differences between them, and we will see this later on. What are the expected learning outcomes this should be with every exercise that we do in the teaching arena? First, you should be able to define what evaluation is. You should be able to discuss the purpose and benefits of it, to discuss the impact of evaluation on learning, and apply evaluation methods to teaching sessions, and implement classroom assessment techniques. We will see that this can be done in various ways, and the experience actually will be very enlightening. So, first activity for this lecture. Number one, I want you to show by raising up of your hands this question, so that we get a rough estimate of the percentages that have or have not. Have you had training on evaluation before? The organizers will help with this. How many people are raising their hands, and roughly what percentage are they? 2, have you used evaluation techniques before? What is the percentage? 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39, 40, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50, 51, 52, 53, 54, 55, 56, 57, 58, 59, 60, 61, 62, 63, 64, 65, 66, 67, 68, 69, 70, 71, 72, 73, 74, 75, 76, 77, 78, 79, 80, 81, 82, 83, 84, 85, 86, 87, 88, 89, 90, 91, 92, 93, 94, 95, 96, 97, 98, 99, 100, 101, 102, 103, 104, 105, 106, 107, 108, 109, 110, 111, 112, 113, 114, 115, 116, 117, 118, 119, 120, 121, 122, 1 Do you think evaluation is necessary? And what is the percentage? Truth be told, many of us would have done this before. When you finish a class, you are having a mental picture of how many students slept, how many students show enthusiasm, what was the reaction of the class after the lecture, how do you feel giving that lecture? So we do this on informal basis, but now we are going to show you how to do this on informal situations, so that you can record, you can go back to them, and you can use them appropriately. So what is evaluation? It's been described as the systematic review of the quality of teaching and learning. And its components are collection of information about our work, in this case, teaching, either in the classroom, by the bedside, in the theater, or on the ward. Interpreting the information. Now you can see why I said that it has to be formalized. Interpreting the information. 3, making judgments about which actions should be taken to improve practice. We often also say that improvement is the biggest room in the world, but it must be guided. And then, of course, taking action, understanding that there are defects, and then taking appropriate actions. So some terminologies, other terminologies. Assessment. This is the one we all are very much used to. And this has been described as the process applied to measure the learner's achievements after a learning program. That is through your end of posting test, examinations, and so on. But you can see straight away that assessments can then be something that may be too late. If you give a lecture today, if you are able to assess, you're able to determine its usefulness, obviously it will then prepare the students more. But by the time you do, even let's say the end of posting, which comes before the main exam, it may be too late to change the understanding by the students of such learning. Appraisal, which is usually more applied to more activities apart from that teaching. So appraisal is the process of assessing the performance of an individual in relation to the objectives, activities, outputs, and targets of a job over a given period of time. And in this is the one students are more liable to confuse, or even the lecturers also liable to shortchange themselves. When with appraisal, you are assessing the whole system, and that will be determined by so many things. And of course, we know that learning actually involves the student, the teacher, and the environment. And so many factors affect each of these parts. Purpose of evaluation. 1, to ensure teaching is meeting students' learning needs. 2, to identify areas where teaching can be improved. 3, to inform the allocation of faculty resources. And this is a place that concerns us very well because of shortages of funds. Many of you have had to give lectures and the electricity is cut off, the instruments malfunction, and such things. Those are part of things that we need to be improved. for the students to learn. And when you have those evidence, and then there is no gainsaying the frustration that may occur to students and to their lecturers. 4, to provide feedback and encouragement for teachers to facilitate the development and review of the curriculum. So you can see Morrison has laid out these 5 items that when you see, you can clearly see the formalization of evaluation that I said. Remember, I said that we all evaluate ourselves and the lectures, but the way we measure are not so structured, and maybe the reason why we are not able to flow with the necessary changes. So, principles of evaluation. 1, evaluation tool must be accurate, valid, and reliable, not just the offhand method that I talked about. 2, data collected must be useful and acceptable. That is, use a combination of qualitative and quantitative tools. One philosopher had actually said sometimes that every human behavior is caused. If you are not able to find a way of determining why something happened, you are not likely to be able to solve that problem. Tools must be cost effective, and this is particularly important. More money does not usually mean better understanding, better way of giving lectures and things like that. So cost effectiveness is a far more robust way of measuring our activities. That yes, for the given amount of money or resources, getting the best out of such is very important. Of course, it's important to note that when the money or the funds are too little, then quality will be sacrificed. But it also does not mean that for quality to be achieved, that's always meaning more money. This is an important differentiation. And 4, the outcome must be used to correct deficiencies and improve processes. There is a reflective cycle that was developed by Graham Gibbs in 1988. Before going further, I also must let you know that in developed countries, students have this file that's called portfolio. A portfolio is a file of documents that a student will need to be making input into every day. At the end of a lecture of an educational activity, a student will think back on what has happened and make notes, what he has learned, what defects are there, what he or she needs to do, which lecturer to contact in order to make sure that topic is well understood. It then gives a very voluminous work, and examining that alone is part of assessment, which is something that we put in the curriculum, the revised MBBS curriculum of 2010. Use of portfolio was one of the ways that we said students should be assessed, and going through what the student has written almost on a daily basis will give you an insight into what efforts that student has put into his or her learning. So this reflective cycle is said to give structure to learning and planning from experiences, and a good way to walk through an experience. Okay, this is it. First, description. What happened? Then this goes into feelings. What were you thinking and feeling? How did the lecture affect you? What did you understand by it? Next is evaluation. What was good and what was bad about the experience? Analysis. What sense can you make of the situation? And conclusion. What else could you have done or done differently? And from this action plan, if it arose again, what will you do? And it goes on, is an unending cycle, it's circular. That is, it doesn't have an end. And that is something that is done by students, can be done by students, can be done by teachers, should be done by institutions, should be done by society, so that you continually improve. You retain what is good and you remove what is bad until you get it right. And even after that, you still continue to improve. This is also another evaluation cycle, that is a particular teaching or learning activity, collection and assessment of evaluation data, reflection and analysis, planning and preparation towards the next exercise. And when this is done, particularly when it is done appropriately, this will lead to better understanding of what needs to be done. There are various ways of doing evaluation. Like I said before, can be self-generated feedback. We do that, but we, again, do not usually have much structure about doing it. And it can be done through previewing. That is thinking about what we are going to do, what we are going to tell the students, and things like that. And this also, again, can put a lot of structure into it. As far back as 2003 or thereabouts, I developed a process whereby at least 48 hours or more before my lecture, I will send my slides to the students, constantly telling them that they should go through the slides. They may not be able to understand most of it, but they'll be able to see words that they're familiar with, or words that they will need to ask questions or even go to check, and also develop questions before they come for the lecture, so that when they come for the lecture, it will be an interactive session, not just a passive reading out of points to them. The next one is retracing. Retracing is what I described, that you are looking back what had happened. But of course, the challenge with that is that during the process of giving the lecture, you are concentrating on teaching, such that you are not really taking very accurate record of what was happening. To improve this, you can do observation, whereby there is somebody recording you, or there's a video session whereby you can go back and see how you have performed. The second one is feedback from colleagues, especially trusted peers, but in developed countries from a senior person. In 2006, when I was doing my master's in England, the younger teachers are usually observed by older ones. So the older teacher will sit at the back of the class making notes and sitting throughout the lecture. And with this, they are able to give feedback about what had been done well, what needed to be done, and this will be reviewed most probably in the staff room to enable them make the person better. Incidental feedback can be done while the teaching is going on. We're going to talk more of this, and there are many things that you can actually evaluate: the attendance patterns, the attentiveness, and the response to questions, comments that the lecturer is asking during the lectures. Then immediately after the lecture, there can be feedback from students through questionnaire and pro forma surveys, focus groups where they are able to not just state their observations, but to be able to discuss them based on their own experiences, expectations, and so on. They can do this by emails and web bots, and they can do this also when they are interacted with by the teachers after in between lectures, especially when they have gained confidence in talking with their teachers, and they can talk freely. So incidental feedback, that is those that like snapshots, but which help in seeing how a lecture is viewed or taken. And the things that are measured are how alert and responsive the students are during the lecture, whether many of them seem tired, distracted, or uninvolved. And I usually tell people, when you are looking at this, for example, and you are giving the lecture in a hot afternoon with no fans, no electricity, and so on, when you look at the students and you say a sizable proportion of them is distracted, they seem uninvolved. I mean, it's in such a situation, it will be difficult to really ascribe this to the way the lecture is being given. And this is where, for example, the influence of the environment has to be taken in. 3, to what extent they react to what is said by looking at the teacher or avoiding his or her gaze. Again, the thing straight away with this is that we are in a country where there is so much respect for the elder and for higher authority. And so when a student locks your gaze with his or hers, then it may be seen as an attitude of defiance, whereas in other places, it is seen as the student being interested, being eager to learn from what is being taught. Then you also have the attendance levels, which can indicate the interest in a particular teacher, especially if it is measured over a series of lectures. It's teacher that is coming once and the students are just knowing this may not mean much, but over a period of time, this will but and again that should be viewed with some caution. For example, students tell themselves about each of the teachers. And so if they are not attending someone's class, maybe from perceptions gained from their predecessors, not necessarily their own exact experience. Then incidental feedback can also be gleaned from pass or failure rates, progression from one class to the other, transfer and dropout rates. Again, like I said, these are methods that are too late to engender rectification. And can also look at patterns of distribution of marks or grades. All this, you can see there are so many ways by which this can be done, but caution should always be given, should always be taken about what is ascribed to what. I mean, thinking about the topics, thinking about the environment and such things. Interviews are also very useful, especially because this then provide opportunity for expression of deep-seated feelings and perceptions and things like that, and explaining why students feel or say what they say. I mean, through discussions, through student panels, and structured group discussions. Of course, they then must not feel the group dynamics must be such that there is no feeling of intimidation and so on. Surveys are also quick and easy to assess using questionnaires, for example. They remain very popular, and electronic surveys are even easier. A lot of us do that now through Google survey and also Monkey survey, SurveyMonkey, which give instant collation and be able to know what percentage. But again, these are not as good as when there can be discussions. You can also get information obtained from assessment of the students, and this is, for example, used to judge whether some questions are too tough or too simple. And that's what occurs with standard setting, whereby each question is put to the test of how fair the question is. I'm sure other lecturers will teach you about this. They may indicate how difficult a subject was to be taught or how easy. We also talked about viewing a video of your teaching, and at higher levels, randomized control trials can be used to determine, to evaluate programs. These are levels of studies that are possible now to evaluate teaching. Watching yourself on videotape, of course, the thoughts that will come to mind will be, what are the specific things I did well? And must note this. Always start with the positive. In any situation there are positive and negative aspects. Always start with the positive so that at least to encourage oneself. What are the specific things I did well? What are the specific things I could have done better? Again, you note the crafting of that sentence. What are the specific things I could have done better? It is not what are the things I didn't do well. That you try not to introduce negativity because of the fact that you should always remember you can improve a situation by noting its good points and trying to dwell on those, noting those that are not good and trying to remove them, but remembering that it is not usually an easy thing. What kept the students engaged? What was it? The illustrations that I gave? Was it the way I was asking them questions? Was it the fact that I was moving about? Was it the fact that I was looking at them directly to see how they are responding to the lectures? When did students get lost or lose interest? Again, if you remember what I said about self-evaluation, you are not able to capture all these things. But here, you'll be able to see at what point, what happened, what part of the lecture, what happened in the class, how I explained, and things like that. When did student get lost or lose interest? If I could do this section over and again, what 3 things would I change? That is when, if you are answering what are the specific things I would have done better, mention 3. And you usually don't need more than that. If you have done 4 things 4 or 5 things that were not okay, then that must be awesome. Maybe lack of preparation and all those things. Then how would I go about making those changes? This will be easy because you have a very excellent record of what happened. So changing would then be easy. Okay. Still continuing on the evaluation, proformas are okay. In that you have set questions that they fill, and then we need to write few comments. Unlike if the students are going to write everything, if they are not well directed, proformas will direct them very well because you have clear instructions, and so they'll be able to understand rather than be thinking about things. And when you leave them to themselves, the students will talk about a lot of things, so many things that may not be relevant or may not even be a function of the teacher. And this is very particularly important when you look at the good aspects of a teacher, and there are some concerns. If we are not careful, we may lose a lot by getting rid of someone who is clearly a good teacher, but who has some things that can be altered to benefit students, to benefit the lecturer, and to also benefit the system. So in that situation, proformas are better than questionnaires. Then you also have web-based discussion boards on which students post their comments and queries with feedback. They write, the concerned lecturer is given the opportunity to explain why that is so, and in an iterative manner, they both will interact very well. You also have the 1 minute paper. This, you can see just 2 questions, that it is not, you are not trying to get everything at once. And you are just trying to get some of the things that are very important. Because remember, if it is too long, people may not be interested. And so this, for example, has just 3 points. And we'll be able to tell, when collated, be able to tell a lot and inform the teacher about what had happened. And usually not enough space for students to write lengthy things that may not really help in the evaluation. Again, you can also use simple questionnaire that is structured. Okay, that you tell them to rate the lecturer or the lecture. And you can see the idea is in crafting of the questions. First one is, was the lecture clear? 2, interesting. 3, easy to take notes from. 4, thought-provoking. 5, relevance to course. Comments. There is little space for the students to derail from what is clearly an important point. For example, in this, there's nothing about the dress of the lecturer, whether the lecturer was chewing gum, although those are things that, for the lecturer's sake, they are important. But for the lecture, that will not be part of the core things that will make a student to learn better. But of course, distractive dresses, distractive mannerisms, and such things can affect students' learning. But this certainly are more objective. There is also, when we're evaluating, it depends on what is being evaluated. And you have this Kirkpatrick model, which is a globally recognized method of evaluating results of training and learning programs. It's said to assess formal and informal training methods and rate them against 4 levels of criteria. Are you expecting a reaction? Is it learning? Is it behavioral change, or results from what you are evaluating? So they are called levels of evaluation. Reaction, excuse me, that is participant views on the learning experience. Good, bad, not so good. Learning, changes in participants' attitudes, knowledge, or skills. Behavior, application, changes in participants' behavior. And result, changes in the organizational system, the patient or the learner. And each is a different level of evaluation after the event. When to schedule an evaluation? 1, depends on the purpose. 2, is usually done at the end of the session, program, or module, and can be done at other times. These are not sacrosanct. It depends on the reason for this. But overall, this is a bit of a joke, but it's something that will help the lecturer not to feel so terrible. And that's when the lecturer is giving the results. Since evaluation is by different individuals, they can't all be good. It's very important that when the results are not so good, it's not what we expect. By the time you stand in front of a class and you give the 1 hour, 1 hour lecture, you expect them to feel very satisfied. So if they are not, then you have to cope with this and move on. But clearly, lessons must be learned. There are these techniques that you can use right in the classroom to evaluate teaching. And there are a set of specific activities that instructors can use to quickly gauge students' comprehension stroke learning. These are flashes that will tell you what is happening and perhaps maybe to change course. They are generally used to assess students' understanding of materials in the current course. With minor modifications, they can be used to gauge student knowledge coming into a course or program. And again, like I said, it can make them can make you to change course if it's necessary. One is the background knowledge probe, a short, simple questionnaire given to students at the start of a course or before the introduction of a new topic. This can even be verbal. For example, asking students, what do you understand by Krebs cycle? Before we start to talk about the Krebs cycle or the ovulation, what do you understand? This is often used, and the question is usually called pre-test. Be able to let you know where to emphasize and where to not spend a lot of time. Can ask what are the things that you want to know. Can also be a way of determining some preconceptions that students may have that are not true. Because if you do not know them, you may not be able to address them and take care of them during the lecture. And so the interacting with the students this way will enable you to direct your exercise so that they'll be able to understand. You might also write questions on the chalkboard or hand out short questionnaires. This should not waste time, and it's also necessary sometimes to include post-tests, which we then make you to see how the exercise has impacted the students and what they may need to do more. You also have the minute paper. 1 minute, the minute paper that posts 1 or 2 questions in which students identify the most significant things they have learned from a given lecture or assignment. This is usually very, very simple and very good. You want to see 1 or 2 things that we need to be changed. It's the beauty of it is that at least you will know that one or two things have been addressed properly, if not others. And the students should be enthusiastic about this, especially if you do it before the end of the lecture, so that you are able to sort it out. It's the same thing will happen if you ask students any questions. But in that one, the students are usually very shy, and nobody may put up his or her own hand. And you may, that opportunity may be missed. So you give them 1 or 2 minutes to write a response on paper, collect their responses and look them over quickly or later. But if it's not a very large class, you can, if you had instructed them not to write lengthy things, you'll be able to collate their responses and help them. The modest point is similar to the minute paper, but focuses on areas of confusion. With the minute paper, you can tell them negative or positive, or good, or things that need changing. But for the modest part, again, you are not using, you're trying to choose the word. Modest point is meaning that something that they don't understand. There is no pressure that something is not saying what the teacher has not done well. Modest point is meaning how well the students had received it. So again, in communication, we need to understand that there is a source where the information is coming from. There is a medium, empty space, and then there is the recipient. For the flow of communication, a lot of issues can occur along the line. A student who was not looking up when you made a point, the student who was distracted, a noise coming from somewhere can make that point a point not to be properly understood. So, but it may be an important one. Excuse me, maybe an important one during the course of the lecture. So the question will be, what was the modest point to this lecture or the assignment? Let them write and then give them feedback. Maybe next class, maybe then, if it is just 1 point, and it requires planning so that they have the time to do. And then class opinion polls, when you tell them, show by raise of hand, or to write 1 or 2 questions, 2 to 4, to uncover students' opinions. What are the benefits of these short ones? They provide just-in-time feedback about the teaching learning process. They provide information about student learning with less work than traditional assignments. They encourage the view that teaching is an ongoing process of inquiry, experimentation, and reflection. Again, I tell my students often, when I give you a 1-hour lecture on anemia in pregnancy, there is no way you're going to use that to understand all the questions that can come from anemia in pregnancy. You still need to go to the clinic, to the laboratories where they do packed cell volume and full blood count, to the blood bank where we get blood to treat a patient who has moderate to severe anemia, to the symptoms and signs that will be occurring in each patient. Bearing in mind that two patients may have anemia and pregnancy. One has multiple pregnancy, the other one has singleton. One is at 36 weeks, the other one is at 10 weeks. All these are ways to learn about that, about treating anemia and pregnancy when they occur in different sets of people. So my 1 hour lecture cannot take care of all this. And you will see it also enables you that when you hear it from me, that is one, that would be two sensory perception, my words and my writings in the slides. But when you combine this with interaction with patients, with taking blood samples, with actually seeing what is done in the laboratory, you are using various ways to combine this learning. And experts in teaching have always said that this will be the best way to understand the topic when you have inputs from all the 6 senses. They help students become better monitors of their own learning. And because in it, you will also see that the students will need to have paid particular attention for them to be able to participate in this assessment. It ensures anonymity and more accurate data than asking for hands to be raised up. They were asking them to raise their hands will serve some purposes. Short, and you can easily get over with, but you may not be able to have records. Again, when you tell them to write, some may fear because their writing may be recognized, and that may be a plus. The electronic methods can be done in such a way that they are better anonymized. Again, this is what I said about resources and cost effectiveness, okay, of teaching. How CAT should be classroom assessment techniques, how should they be used? Decide what you want to assess about your students' learning from a classroom assessment technique. You must be very intentional about what you need to assess because you do not assess everything. Choose one that provides that feedback and can be implemented easily in your class. Explain the purpose of the activity to students and then conduct it. Let them not be telling you about electricity challenges or that the place is hot. That will not be what you need that assessment evaluation of that teaching. It is not to say that that is not important, that students can be taught everywhere. No, that is not that. That is another area whereby you will assess the environment. But this is teaching. So you must let them understand that. After class, if not during, review the results, determine what they tell you about your students' learning, and decide what changes to make. This is all about what we've been talking since, that when you collect the data, how would they be useful? So planning, so activity 2, planning and evaluation in groups of 4, in 4 groups. The class we consider the most appropriate evaluation for these teaching sessions. That is, how will you evaluate bedside teaching of an examination stroke procedure? Okay, the hint here is that you are evaluating a process, and there'll be components of it. Okay, there'll be components of it such that there may be a rate limiting step. Part of the components maybe will be assessed differently. So you will not use just one method. Okay, and for this, you are expecting a behavioral change. That is, when you teach an examination or procedure, you want the individual to be able to replicate it. And again, we must understand something about when you about a skill, or we want them to gain competence in something. There are 4 levels of 5. First is that they must know about it. A student can read about the procedure and tell you verbally all about the procedure. That is just one level. The second thing to gain competence is observing that procedure being done. Again, in this, you remember our challenge that a lot of the things that we talk about are not available. Just like in the beginning, when a lot of people were learning A for apple, but apples were not available. So the same thing. I was surprised to see exactly what a worm's catheter actually looked like after about 45 years that I've been hearing about worm's catheter. So those are things that are very important when you are teaching skill. So must be able to see the procedure, must assist with the procedure is level 3 of competence, must be able to do the procedure under supervision, 4th level of competence, and the final level is that the individual is able to do the procedure without supervision. And this applies to every of the skills that the students will learn. So how you evaluate each step will be different one for the other. The second group with demonstration of a surgical procedure. That is when you demonstrate the procedure, the areas of difficulty will be different and the evaluation of each will be different. Small group teaching in a laboratory. This again too is a step-by-step thing, and how you evaluate will be important. Then group 4, lecture given to a large group of students. And this is one area where the modiest part or minute, 1 minute assessment will be important. One, it's a lecture. It's something that they just need to understand. It's not something that they are going to perform. Secondly, you have 100 of them. If you ask, if you want to assess them, you cannot. It will take a long time for you to be able to get most of them to do the assessment. And so in that situation, you may not be able to get a good grasp of what they don't understand if you use complicated methods. But for those earlier ones where there are smaller groups, you need to evaluate multiply. Okay, so for all this, which evaluation method will you use? The organizers will do that. They are also the key points in administering evaluations. First, set aside class time, because when the more the percentages of students that respond, the better will be the evaluation. If a few people are responding, then you are not getting a good grasp of what is happening, whether good or not so good. So more than 80% of them responding will give you a clear idea what has happened. Review written comments. Once they've made comments, you must review them and analyze and so that be able to get key points. Pinpoint specific complaints and determine whether the complaint is justified. Like I said, if they are talking about electricity, your lecture is not what is affecting electricity, but then their learning can be affected when there is no electricity. And in this, as a good teacher, it's also within your mandate to try to find solutions to it as much as possible. And if solutions cannot be easily found, to at least to make efforts and communicate this with the students. If there are one or two hurtful statements, ignore them. Like it was written with the woman beside the computer. Ignore them. You are human, and they are also human. So, but you must, even while ignoring them, you must ensure that they are not things that you can or you must also rectify. Save lengthy and meaningful positive comments and incorporate them into your teaching statements. Tape your favorites next to your computer to keep you inspired. Those that say good things about you. Like I said, always look at the positive points. In conclusion, in rounding up, educational evaluation is the systematic review of the quality of teaching and learning. Okay, you are teaching, the students are learning. Both must go together and must intertwine. Remember the evaluation cycle: activity, collection of evaluation data, reflection, analysis, and planning and preparation for the next one. Feedback can be incidental from self, from colleagues, and from students. Evaluation can be focused on 4 levels: reaction, learning, behavior, and results. Classroom assessment techniques can be used to quickly gauge students' comprehension. Finally, education is a complex process, and there's a need for continuous evaluation. It is very complex, and this should be remembered at all times. Once again, my gratitude to Dr. Lola Akonde, with whom we developed this. We developed this together. To the organizers, ably led by Professor Augustine Adeolu, and the lecturers working with him, and also the support staff, the administrative staff. They've all been doing everything to make sure that this exercise goes on every day. And we thank them. And to the students who will be evaluating this lecture too. Now, thank you. It is not easy to get advanced people, lecturers, senior lecturers, even professors, to come and sit down and to be taught. when you are lecturing, you believe that you've known everything. Otherwise, we'll call you to come and lecture. So when you then agree to sit down and give and receive lectures, I usually give kudos to for such. And these are some of the references, and we say thank you. We would like to entertain questions and comments. Thank you, ladies and gentlemen.